Okay, and then my other question, which would be my last question, is state control. You know, there are concerns too about the fact that, you know, we want to be able to run that exchange how we want to run it. We don't want to have to continue to get waivers, continue to get, you know, permission from the federal government to do whatever if we think it's in the best interest of Arkansas, and we think it is. How confident are you that we are really going to have control over this exchange and be able to do the things that we wanted to do without having to ask for a lot of waivers, without having to go through a lot of red tape, you know, federal government, bureaucracy, and everything in Washington DC?
That's a good question. There are several variables in the not too distant future. Particularly in we have elections obviously in 2016. We don't know who will be running the executive branch. Big question mark. Also in 2017 though, there is written into the law this provision for states to get what they call state innovation waiver. And if a state is granted a state innovation waiver, what that waiver says is essentially you now don't have to do. There's very little that's in the ACA with which you need to be compliant. You can come up with your own plan as long as you can demonstrate that you can insure at least as many people as were insured otherwise. Now I know that's a waiver, but it is a big blanket waiver. And I think that is a prime opportunity for lawmakers to get out and talk to their constituents, figure out what it is they want. Because that's where you can get your creative juices flowing and figure out what really works for our state. There are a number of things you get done, and it's in one waiver as it's been presented today. Now, again, I don't know what the future holds. They could decide they want, 10 other waivers under that umbrella. I don't think that's the case because they have been, one of the things the federal government has done is fund to a large degree the innovation models that are coming out of the states. The federal government never saw themselves having to run the exchange in 30 or more states. They originally intended for states to want to do this. They thought it would be very attractive. They didn't anticipate the pushback. I think actually the federal government, particularly HHS, would be happy to see that go back to the states.
Okay, thank you. Thank you, Mr. Chair.